while the death count has now reached nearly 233,000. Now, many said that the virus was also on the ballot yesterday, in addition to the two presidential candidates. So let's chat this some more now with Dr. Andre Campbell, professor of surgery at UCSF. He's also an ICU doctor and trauma surgeon at Zuckerberg San Francisco General Hospital. Dr. Campbell, I want to start with this election result and how you see the elections impacting our ability to fight the pandemic going forward. As I mentioned, 9.4 million cases in the United States right now.
Well, first of all, thank you for having me on today. I think all of us are a little bit shaken because of the political climate. But I think regardless of what's happening, what I'm hoping is that we will allow the science to drive what has to be done related to pandemic. The pandemic is clearly out of control. It's going up in 42, 45 states out of 50. We're at about 90 to 100,000 cases a day. Today, there was 1,100 people who died from it. So the pandemic is really still going. We have to have the science driving it. We can't have someone going around doing super spreader events as part of a matter of protocol. So meaning the president, we have to basically step back and basically have the national policy. And that's really what's been the failure. In my opinion, we've not had a national policy about how we're going to attack it. So if things change and Mr. Biden gets in, I hope that we will have a national plan where we will be able to face this together, because the only way we're going to do this is to do it together. And right now, we're a bit split apart because of all the issues. Things have become political that are not political. And that's really part of the problem.
Now, of course, the former Vice President Joe Biden does take the presidency. It's expected that there would be a national mask mandate, which a lot of doctors and public health officials had been calling for. However, even if he wins the presidency, he would not take office, Dr. Campbell, until January. So still several months to go as we are seeing coronavirus cases spike and surge across the country. So what is your outlook between now and January, right, when we might get a new administration? What do you think is going to happen in those interim months? Winter is coming, flu season is coming. What could happen until then?
Well, what's going to happen is I think that you've heard from Dr. Fauci and Dr. Burke that we're going to go through a very dark period. If we're at 90 or 100,000 cases, once it gets really cold and everybody goes inside, we're going to have an even more higher. We may go north of 100,000. We may get up to 500,000 people dying. You heard the numbers you just said, north of 230,000 people have died from this. It will get worse in the winter, assuming we don't change course. We're going to have to change course and move forward. The masking, the distancing, the hand washing, all these things. This is something that we can. If we had a national mandate, we may reduce the number of deaths by 70, 80,000. So I think that that's one way we can go, because that's something we can do. Protects me and protects you. We can do that together. But right now it's become political. You wear a mask, it's political. It is not political. It is common sense. It is public health policy. We have to move forward by doing that together.
I have about a minute left with you here, Doctor. Now, something that has become political is lockdowns. A lot of people do not have an appetite for it. Do you think we're heading into a scenario where we have to lock down the country again?
Well, I think that, first of all, I think you know that in Spain there's a lockdown, in England there's a lockdown. They actually have a lot less cases than we have. Doing a lockdown here is going to be difficult. But I think if we use masking, we may not have to have a lockdown, because I don't think anybody wants to have lockdown. I think there is a certain amount of pandemic fatigue. Everybody's tired of being inside, tired of not socializing. But I think the masking mandate is actually much better than a lockdown. But if we're going to have to, if we get to 150, 200,000 cases a day, right, this means that we're going to have to do something quite radical to reduce that. If masking will reduce it some, but if we're going to have to do it, we'll do it. But I think it's better for us to think more broadly and doing the masking as opposed to doing a lockdown. But we have to do what we have to do to save lives, because we can't have more cases going up north of 100, 150,000 cases, which may well happen in the winter.